You know, it's funny, right? Like how we're just bombarded with health information everywhere we turn these days.
Oh, absolutely.
You're strolling on your phone and boom.
Yeah.
Suddenly you're supposed to be an expert on like the newest superfood or some crazy new drug everyone's talking about.
Yeah.
I mean, for folks like you and me, I think, who really want to be informed, like we want to understand this stuff, it could feel so overwhelming.
It is.
Like, where do you even begin, right?
Yeah, it really is a different world now. I mean, it wasn't that long ago that if you wanted medical information, you basically had to go through the healthcare system,
Right.
Talk to a doctor, read a medical journal. Like, that was pretty much it.
Exactly.
But now it's like a fire hose of data coming at us from all directions.
Yeah.
And it's not always, well, it's rarely actually, presented in a way that helps you sort the truly useful information from the stuff that's just, noise.
Totally. And I feel like that's what we're going to be diving into today. Like we've got this collection of really interesting material that looks at how things are changing in, I guess you could say, the world of drug therapy.
Right.
It's definitely a 21st century kind of problem.
Definitely.
So think of this like a deep dive, right? We're going to pull out those key ideas, point out some things that maybe you haven't thought about before, and hopefully by the end, help you feel a little bit more confident navigating all of this.
That's the goal. We want to make sure you're getting like the most important insights without having to wade through, like you said, that fire hose of information. And it really is all connected. We're going to be talking about how this information actually reaches us, like as consumers.
Right.
And how the whole healthcare landscape is kind of shifting, and some of the big public health issues that are shaping, how we use and view medications.
Okay, let's get into it. So we were talking about this a minute ago, but I want to unpack it a bit more. I mean, this idea that information about healthcare is so easily accessible now, it really has changed things.
All life.
Like, it used to be that, you go to your doctor, they tell you what's what, and that's pretty much it.
Right. You trust your doctor.
Exactly.
Yeah.
But now, it's like everyone has access to all this medical and pharmacological information.
Yeah.
And I'm curious, like, how has this really changed things? Especially when we think about that patient-provider relationship.
Well, it's really flipped the dynamic in a lot of ways. I mean, patients are coming in, they're not just passively taking in what the doctor says anymore.
Right.
They've often done their own research, sometimes a lot of it. They might have already formed an opinion about what's wrong with them or what treatment they want.
I can see that.
And it's kind of a double-edged sword, to be honest.
How so?
Well, on the one hand, if a patient is well-informed, they can be a lot more involved in their own care, right?
Right.
That can be great.
Right.
But the problem is the information they're bringing in isn't always accurate or reliable.
Yeah.
And sometimes it's just not relevant to their specific situation.
That makes sense.
I mean, we've all heard of Dr. Google, right?
Oh, yeah.
Where people try to self-diagnose based on something they read online, and it's not always a good outcome.
Yeah.
So for healthcare providers, it's not just about diagnosing and treating anymore. They also have to be able to deal with misinformation, which is a whole other skill set. And they have to do it in a way that's both sensitive and accurate.
That's a really good point. I mean, you have to acknowledge that people are coming in with this information and be able to address it.
Exactly.
And it's not just Dr. Google either, right? I mean, we have to talk about advertising.
Oh, for sure.
Think about how many prescription drug commercials we see now. It's crazy when you realize that wasn't always the case.
Yeah, it's really changed the landscape.
So what are some of the things we really need to understand about this direct-to-consumer advertising?
Well, first, let's just talk about the legalities of it. There are rules in place, thankfully.
Oh, good.
So if an advertisement mentions what a drug is supposed to treat, they're legally required to also state any contraindications.
Like when you shouldn't use the drug.
Exactly. And they have to mention potential side effects and precautions, too. But here's the thing. The way they present this information can sometimes downplay the negatives.
It's like that super sassed voice at the end of the commercial, rattling off a list of side effects. Always like, wait, what was that? Did they just say it could cause, like, spontaneous combustion?
And then you've got those ads where they don't actually say what the drug is for at all.
Oh, yeah.
It's all about creating a feeling, an association.
Right. It's like, take this drug and you'll be happy.
Exactly. It's all about imagery and emotional appeals. Like, think about those ads with the older couple dancing on the beach,
Yeah.
They're advertising medication for erectile dysfunction, but they're selling you this idea of youthfulness and enjoying life.
It's clever, but it's also kind of misleading.
Exactly.
Yeah.
And it's not just during primetime TV either. You see these ads in places you wouldn't expect, like parenting magazines.
Oh, wow.
Yeah, for medications that are used in kids, antibiotics, asthma medications, things like that. And a lot of times these ads show these like happy, healthy kids, which can put a lot of pressure on parents.
To ask for that specific drug.
Yeah. They might feel like that's the only or the best solution for their child, even if it's not really the most appropriate choice medically.
So then the pediatrician is stuck having to explain why maybe that drug isn't the best option.
Right. Which can sometimes be a tough conversation.
It feels like healthcare providers are constantly playing catch-up with all these trends that are being highlighted in the media, you know?
Oh, absolutely.
Like there's a new study or the disease of the week on some talk show, and then patients come in with questions.
It's a constant challenge. The media often takes complex medical research and tries to simplify it for a wider audience.
Which I guess makes sense.
Sure. But in doing that, some of the really important nuances get lost. Or sometimes the conclusions they present aren't totally accurate.
So people might end up thinking, oh, this is a miracle cure, or this is way worse than I thought.
Exactly. And that can lead to people seeking out treatments that haven't really been proven to work, or having unrealistic expectations about the treatments that do exist. So healthcare providers have to be prepared to address those misconceptions.
And then, of course, we have the internet, which is, you know, on the one hand, an amazing resource for information, but on the other hand, can be completely overwhelming and difficult to sort through.
It really is. There's so much drug information online, it's almost impossible to keep up. You've got information from pharmaceutical companies, patient support groups, online pharmacies, research databases.
It's a lot.
It is. And for most people, it's hard to know what's credible and what's not.
I bet.
And remember what we were talking about with those direct-to-consumer ads?
The emotional appeals and stuff?
Yeah. Well, you see the same thing online. A lot of the information is presented in a way that emphasizes the positive and downplays the negative.
Can you imagine being a healthcare provider and having to go through all this stuff that patients bring in?
Oh, I'm sure they spend a lot of time doing just that, trying to figure out what's actually helpful and what's not.
It must be tough.
It is. It takes a lot of time and skill to evaluate all this information. But there are some things you can look for, like the website's domain name.
Like .gov or .edu.
Yeah. You want to see who created the website and what their credentials are, when it was last updated, if they cite their sources, if they're transparent about funding or any conflicts of interest they might have.
Good points.
All things to keep in mind.
Okay, let's shift gears a bit and talk about medications that people can get without a prescription. Over-the-counter drugs.
OTC.
Yeah, OTC drugs. They're so convenient for those everyday kind of health issues. But I'm wondering if there are things we should be aware of, like any hidden complexities or anything.
You know, it's interesting when you think about the history of how these drugs are regulated. A lot of the older OTC drugs were kind of grandfathered in.
What does that mean?
Well, they were already being sold before the FDA had these really rigorous testing standards in place.
Oh, interesting.
So they were basically allowed to stay on the market without going through the same level of scrutiny as newer drugs.
So are they still safe?
Well, that's the thing. The FDA is constantly reviewing these older medications, and sometimes they decide that a drug that was considered safe before isn't really safe anymore, or maybe it doesn't even work.
Can you give an example?
Sure, like Ipecac syrup. Do you remember that?
I think so.
It used to be a staple in most medicine cabinets. People used it to induce vomiting, like if a kid swallowed something poisonous.
All right.
But the FDA reviewed the evidence and found that it wasn't actually effective and could even be dangerous.
So they took it off the market.
Yeah, it's not recommended anymore. So the point is, just because a medication has been around for a long time and you can buy it without a prescription doesn't necessarily mean it's gone through the same rigorous testing as a newer medication.
That's good to know.
It is.
So essentially, with OTC drugs, you're kind of taking on more responsibility for your own health,
Yes.
right?
You are. You have to be able to accurately diagnose yourself, which can be tricky.
Yeah, no kidding.
And you need to understand how to use the medication properly. The FDA actually considered making lovastatin, which is a drug to lower cholesterol, available over the counter.
Oh, wow.
But they decided against it because to monitor cholesterol levels, you need a blood test.
Right.
And that's not something people can do at home.
So they figured it was too risky.
Yeah. People could be taking it without really knowing if they needed it or if it was working.
That makes sense.
And you know, another issue with OTC drugs is that they can mask symptoms of underlying conditions.
Oh, right, because you're just treating the symptom, not the cause.
Exactly. And that can delay a proper diagnosis, which can sometimes be a big problem.
Yeah, that's a good point.
And people don't always read the instructions or follow them carefully.
Oh, yeah, I'm guilty of that.
I think a lot of us are.
Yeah.
And then you have all these combination products. You know, you've got a headache, a runny nose, a cough, so you take something for each symptom. But you don't realize that those different products might contain the same active ingredient.
Like acetaminophen?
Exactly. You could end up accidentally overdosing.
I've definitely seen that on the labels. Like,
Yeah.
don't take this if you're already taking.
Right, and it can be really confusing.
So what's the takeaway here? Like, what should we be telling patients?
Well, first of all, healthcare providers need to be specifically asking their patients about OTC drug use.
Because patients might not think to mention it.
Yeah, exactly. They might not think of it as a real drug.
Right.
And then, patient education is crucial. They need to know which OTC drugs to avoid if they're taking certain prescription medications, and they should always consult with their doctor or pharmacist before starting any new OTC drug.
Good advice. Okay, let's talk about another type of self-care that's become really popular. Herbal and alternative therapies.
Yeah, these are really interesting. They're gaining popularity, but they're regulated very differently than conventional drugs.
Right. We're talking about things like herbal remedies, supplements, natural products, things that have been used for centuries in traditional medicine.
Yeah.
But how does the FDA view these things?
Well, they consider them to be dietary supplements, not medications.
So what's the difference?
That's a key distinction. It means they don't have to go through the same rigorous testing and approval process that drugs do.
So they're not as closely scrutinized.
Right. Now, some of the active compounds in these herbal remedies have been extracted and developed into FDA-approved medications.
Okay.
But the supplements themselves are kind of in a different category.
So just because something is natural doesn't necessarily mean it's safe.
Exactly. Herbal medicines can have side effects, they can interact with other drugs, and their quality can be inconsistent.
Like you don't always know what you're getting.
Right. The ingredients and their concentrations can vary from one manufacturer to another, or even from batch to batch.
So it makes it hard for healthcare providers to manage, right?
It does. If a patient is using herbal remedies alongside their prescribed medications, it can be tricky.
You don't know how they might interact.
Exactly. So it's really important for patients to be open with their healthcare providers about what they're taking, even if they think it's just a harmless herbal supplement.
And for providers to ask about it, too.
Absolutely. It's all about open communication.
Okay, let's shift gears again and talk about some of the bigger issues that affect public health, and by extension, how we approach drug therapy.
Things like bioterrorism, the opioid crisis, and pandemics.
Exactly. These are huge challenges that influence how we think about drug safety and public health on a really large scale.
Definitely. They expose vulnerabilities in our healthcare system, and they highlight the importance of being prepared, responding effectively, and having a strong public health infrastructure.
Okay, let's start with bioterrorism. The use of biological weapons is a terrifying thought, and it's become a much bigger concern since 9/11 and those anthrax attacks.
It's a serious threat.
What are we doing to prepare for that kind of event?
Well, since those events, organizations like the CDC and the Office of Homeland Security have been working really hard to develop better preparedness strategies and treatment guidelines.
I could see that.
Education is a big part of it, too, both for healthcare professionals and for the public.
Like knowing the signs and symptoms of exposure.
Exactly. The CDC website is a great resource, by the way, if you're interested in learning more.
Okay, good to know. And then we have the opioid crisis, which is just a devastating public health emergency.
It really is, and the statistics are pretty shocking.
Tell me about it.
The CDC has reported that most drug overdose deaths in recent years have involved opioids.
Most, wow.
Yeah, and that includes prescription opioids, heroin, and fentanyl. And a lot of these deaths are due to those super potent synthetic opioids.
It's scary.
It's a really complex problem because you've got people misusing prescription painkillers, and then you've got addiction to illegal drugs, and there are a lot of social and economic factors that contribute to it. We've seen stricter regulations on prescribing opioids, but the number of deaths from illegal opioids is still incredibly high.
So what are we doing about it?
Well, there are a lot of different approaches. We're trying to control opioid prescribing more tightly, make naloxone more available.
Well, naloxone is that drug that can reverse an overdose, right?
Yeah. And we're putting more resources into research.
Research into what?
Into developing safer and more effective pain management options and finding better ways to treat addiction.
Good.
It's important to understand that many illegal drugs, including opioids, are highly addictive. They change the way your brain works, and that makes recovery really, really hard.
Yeah.
And it's not just addiction either. Using street drugs can have other really serious consequences for your health.
Like what?
Well, they can mask symptoms of other medical problems, and there's always the risk of dangerous drug interactions.
Because you don't know what's in them, really.
Right. Healthcare professionals need to be aware of the drug trends in their communities and know what resources are available to help people who are struggling with addiction.
Like, where can they go for information?
The National Institute on Drug Abuse, NIDA, has a lot of great information and resources.
Good to know. And finally, let's talk about the COVID-19 pandemic. I mean, that's had a huge impact on healthcare in so many ways, including how we access and use medications.
Absolutely. It's changed the landscape in ways we're still trying to figure out.
Like how?
Well, for one thing, it really highlighted the connection between having a job and having health insurance.
Right, because so many people lost their jobs and their insurance.
Exactly. And then there was the sudden shift to telehealth for outpatient visits.
Yeah, seeing your doctor on Zoom.
Right. It was a huge change, and we're still trying to understand how that will affect things in the long run.
It will be interesting to see how that plays out.
It will. And at the beginning of the pandemic, there were concerns about disruptions to the pharmaceutical supply chain.
Oh, right. Like, would we have enough medication?
Exactly.
Yeah.
And that led to more people getting their prescriptions through mail order and home delivery.
It's amazing how much changed in such a short time.
It really is.
Okay, so we talked about a lot of different challenges. One we haven't really addressed yet is the cost of healthcare.
That's a big one.
Yeah, I mean, the cost of healthcare and prescription drugs is a huge burden for a lot of people.
Especially for people living on fixed incomes. It can force them to make really tough choices.
Like whether to buy groceries or medicine.
Exactly. And sometimes people just don't fill their prescriptions because they can't afford it.
Oh, I'm sure that happens a lot.
It does. Or they might try to stretch their medication by stopping early. Like not finishing a course of antibiotics.
Right, which can be really dangerous.
Yeah.
It can contribute to antibiotic resistance. And it's important to warn people against splitting tablets to save money.
Oh, yeah, that's a bad idea.
It is. Unless their doctor has specifically told them to do it, it can be dangerous with some types of medications.
Makes sense.
So generic drugs are often seen as a way to reduce costs.
Which they usually are,
They
right?
usually are. But there are some exceptions.
Like what?
Well, sometimes a doctor might prefer to prescribe the brand name drug, even if it costs more.
When would that be the case?
If it's a drug with a narrow therapeutic index, for example. Meaning the difference between a safe dose and a toxic dose is really small.
Oh, I see.
So consistency is crucial. And surprisingly, sometimes the generic drug actually costs more than the brand name.
Oh, who knew?
People are using websites and apps to compare prices. And some people are even ordering drugs from other countries to save money.
Oh, wow.
Yeah, but the FDA warns that those drugs might not be safe.
I can see why.
They might not have been manufactured or stored properly.
Okay, so with all these cost pressures,
Yeah.
and with more and more people being discharged from the hospital sooner, it seems like patient teaching is more important than ever.
It absolutely is. Patients need to be really well informed about their medications.
What do they need to know?
Everything. The name of the drug, both generic and brand name, the dose, how often to take it, what it's for, how to manage side effects, which OTC drugs or supplements to avoid, any warning signs to watch out for, how to store it properly.
It's a lot of information.
It is. And it needs to be explained clearly in plain language.
And in writing, too, right?
Ideally, yes. Especially for people who are taking multiple medications.
So nurses play a big role in this.
A huge role. They have to organize and simplify this information for patients.
And it's worth the time, right?
Absolutely. Taking the time to teach patients properly can prevent a lot of problems down the road. And with home health care becoming more and more common, the nurse's role in educating and supporting patients is only going to become more important.
Okay, last but not least, let's talk about the environment.
Ah, yes.
It's kind of scary to think that prescription drugs are showing up in our drinking water.
It is concerning. Now, wastewater treatment plants do a pretty good job of removing most of these contaminants.
That's good.
Yeah. But it's still a problem, and we need to be thinking about it.
So how are these drugs getting into the water in the first place?
Mostly from people flushing unused or expired medications down the toilet or sink.
Oh, right.
The FDA has guidelines for how to dispose of medications properly.
Okay, what do they say?
Basically, you take the medication out of the original container, mix it with something undesirable, like coffee grounds or kitty litter, put it in a sealed bag, and throw it in the trash.
Okay.
There are some medications that you should flush, but only if the label specifically tells you to.
Okay.
And you should always scratch out any personal information on the prescription bottle before you throw it away.
Good tips.
We should all be cleaning out our medicine cabinets regularly and disposing of unwanted medications properly.
All right, so to sum up, navigating the world of drug therapy today is complex. We've got information overload, self-care is becoming more common, but it's not always straightforward. Drug costs are a big concern, healthcare is moving into the home, and we're facing some pretty serious public health threats.
It's a lot to keep track of.
It is, but it's important for everyone to be informed, especially folks like us who are involved in healthcare.
Absolutely.
So here's something to think about. With all this information becoming more accessible, and with the focus shifting more towards patient-centered care, how do you see the relationship between patients and healthcare providers changing in the future?
That's a great question. And it's one that doesn't have an easy answer. It's something we're all going to have to keep thinking about as healthcare continues to evolve.
Thanks for that insightful thought, and thanks for joining us today for this deep dive.
Thanks for having me. It's been a pleasure.